Hello everyone, welcome. I'm Dana Burnett. I'm a nurse from the emergency room department here at our hospital. It has been brought to senior leadership's attention that we've had an increased rate in CAUTIs, catheter-associated urinary tract infections. I've attached a PowerPoint to this presentation for you to follow along, or if you prefer, you can print it out and take notes on it. So if you have any questions, you can email me or any of your senior leaders to get those questions answered. We're talking about preventable urinary infections. Our protocols now are to use aseptic technique, which is apparently not being effective. We also are having trouble with leaving our catheters in for longer than necessary amounts of time, whether that be because we do not have an order to have them removed or if they're just being forgotten about. These are preventable infections. They cost the patient time, money, unnecessary use of antibiotics, and the hospital is not reimbursed for these infections when they're acquired while our patients are with us. Let's prevent these. We have a team put together that we have discussed alternatives to urinary catheters. We are starting in the ER with a new product called a PureWook. This is an instrument that can be used to collect urine via suction. They will have them in the ER in the next week with a rep here to teach you how to use them. We also have male and female urinary urinals so that if a patient is unable to get up to use the restroom and the bedpan is something they are not comfortable with, they can use the urinal. We have bedside commodes. Let's try and use some of these things to prevent these infections. The team we put together is consisting of physicians so that we can get our appropriate orders. We have our nurses to follow the protocols. We have our IT department, which has come up with a hard stop in our charting and documentation so that we can be sure that we get those catheters out at an appropriate time and that they are not put in for unnecessary reasons. Finally, we have our nurse educators and senior leaders that will help make sure that we're staying on track. They will look over the paperwork, the charting. We also have a new check sheet that our charge nurses will do a daily audit with that will be reviewed to help keep us all on track and keep our patients healthy. If you have any questions, you can let me know. My email will be listed at the end of the PowerPoint presentation. Thank you.